Today topic is general scheme of case taking. Next, chief complaint. The complaints of the patients are recorded under this heading in a chronological order of their appearance. The patient is asked, "What are your complaints?" If you dull patient do not really understand what do you want to know and may start irrelevant talk. In this case, he should be asked, "What brings you here?" You should also know the duration of this complaint. For this, ask the patient, "How long have you have suffering from each of these complaints?" They should be recorded in a chronological order. As for example, in case of a sinus in the neck, the complaints may be put down in the following way. Swelling in the neck, 1 year. Fever mostly in the evening, 10 months. Slightly pain in the swelling. Slight pain in the swelling, 6 months. Sinus in the neck, 1 month. If a few complaints start simultaneously, list them in order of severity. The student should make it very clear that the patient was free from any complaints before the period mentioned by the patient. For this, the student should ask the patient with sinus in the neck, were you perfectly well before the appearance of swelling in the neck? This is very important, as very often the patient may not mention some of the previous complaints as he considers them insignificant or unrelated to this pathologent trouble. But on the contrary, this may give a very important clue to arrive at a diagnosis. As for example, a patient with rigidity and tenderness in right hypochondrium region of the abdomen may not have told you of this hunger pain a few months back, but this simple hint at once tell you that this is a case of peptic perforation. Next, history of present illness. This history commences from the beginning of the first symptoms and extends to the time of examination. This includes the mode of onset of the symptom, whether sudden or gradual, as well as the of onset. If at all present, the progress of the disease with evolution of symptoms in the exact order of their occurrence. And lastly, the treatment which are which the patient might have not received, the mode of treatment and the doctor who has treated. To know the mode of answer, the patient asks how did the trouble start. To know the progress of the disease, the patient is asked what is the next thing that happens. Yeah, any such irrelevant relevant question as the type of case may necessitate. This should be recorded in the patient's own language and not in scientific terms. The patient should be allowed to describe his own story of the symptom. They know more about their complaints than the doctor. But if they wander too far from the point, they should be put such a question as to bring them back into the matter. Never ask the question, "What are you suffering from?" The patient will obviously tell you his another doctor diagnosis, which do not want to know. Leading questions should not be put to the patient. By this, it is meant that question which is only one answer should not be asked. As for example, if the patient is asked like this, does not the pain move to the inferior angle of the right scapula? Obviously, a well-behaved patient will answer yes to please you. So the question should be such that it leaves the patient with free choice of answer. As for example, the question should be, does the plane ever move? If the patient say yes, you should ask, where does it go? So the question should not necessarily be leading, but to the help the patient to narrate the different aspects of his symptom to arrive at a definite diagnosis. Sometimes negative answers are more valuable in arriving at a diagnosis and should never be disregarded. As for example, in case of a sinus on the neck, absence of the history of the watery discharge at a time of means at one exclude the possibility of a aortic fistula associated disease. Patient may be suffering from Patient may be suffering from associated medical disease apart from the one which she is complaining of: diabetes, high blood sugar, high blood pressure, asthma, tropical disease, bleeding disorder, rheumatic fever, या even early syphilis या gonorrhea. This history is highly important as it may require additional treatment. Past history. All the disease suffering by the patient previous to the present one should be noted and recorded in a chronological order. There should be mention of dates of their occurrence and duration. This may have influence on the present condition. Peptic ulcer, acute pancreatitis, tuberculosis, gallbladder disease, appendicitis, etc. are important. Students should not forget to mention any of the previous operations or accidents which the patient might have undergone or sustained. The date and the types of operations should be mentioned in a chronological order. Drug history. The patient should be asked about all the drugs he was on. Besides the fact that this will help to give a clue to the patient illness in a subsequent treatment, it has a tremendous importance from aesthetic point of view. A special inquiry should be made about steroid, insulin, antihypertensive derivatives, monoamine oxidase inhibitors, hormone replacement therapy, contraceptive pills, etc.